Do you hear me?
Yes, we hear you.
Thank you. Thank you very much. Okay, hello, good evening, everyone. My name is Ahmed Al Asyuti. I am a health educator from Qatar Diabetes Association. And I would like to thank you on behalf of Qatar Diabetes Association on joining us today on this one of the series of our interactive sessions about diabetes. So today it is going to be an introduction to diabetes. This session is going to take around 45 minutes. During the session, I might ask you some questions, and then you will see the question on your laptop or mobile phone with 3 options. Choose the right answer, and then we are going to discuss together the answers. Okay, so today we will discuss the following points. First, we will know what is diabetes and how it happens. And then we will talk about the symptoms of diabetes. We will know the types of diabetes, the complications that arise from high blood glucose, and then the risk factors, or the factors that increase the risk of developing diabetes. And finally, we will answer the important question: is diabetes preventable, yes or no? Before we start, I'm going to show you some numbers here. It's from the International Diabetes Federation. As we see, those numbers are in millions. In the year 2000, the people living with diabetes around the world were 151 million people. And as the time passes by, those numbers are getting increased. The last year, 2019, it reached 463 million around the world, and it's expected to even go more than that. Those numbers are worrying. So globally, the diabetes, more and more people are getting diagnosed with diabetes. We will know why. This 9.3% is the prevalence of diabetes around the world. It's a small number if we see it from a whole point of view. But let's see what happens here in Qatar. Okay. Now this leads us to the first question. Do you know what is the prevalence of diabetes in Qatar? I'm going to, now you'll see the question on your screen. Show me your results. Try to answer and let's see. Is it 5% or 9% or 17%? The prevalence of diabetes in Qatar. The majority are right. The prevalence of diabetes in Qatar is 17%. And this number, compared to the population of Qatar, is quite high. If we take a comparison, for example, with another country like Canada, in Canada, the population is 35 millions, and the prevalence of diabetes is only 7.3%. That's not it. Let's see, in a study that was done by Weill Cornell University here in Qatar in 2018, they predict that by the year 2050, this percent is going to reach 25%, which means that every 4 people, one of them is going to be living with diabetes. So in order to prevent this number from happening, we need to be aware about diabetes, about the symptoms of diabetes. We need to educate ourselves and people around us about diabetes, and we should know when to advise someone to check his or her blood glucose if we see the signs on him or if we know the results. So let's see, what is diabetes? Diabetes is a condition, it's a chronic condition characterized by an increased blood glucose level above So as I was saying, if you hear me, diabetes is a chronic condition characterized by an increase in the blood glucose levels above the normal range. So by chronic, we mean that it's not transient, it's not acute, it doesn't come and go within a limited time. Okay, so it stays for long. As long as you have diabetes, then you need to control it. If you control it, your readings and your blood glucose is going to be within the range, the targeted range. And if you stop controlling it, it's going back to get high. So this is what we mean by chronic. And the increase in the blood levels above the normal range brings us to the state of diabetes. So we need to know what is the normal range of our blood glucose. This brings us to the next question. And also here, the majority are right. It is 70 to 140 milligram per deciliter. Okay. So this means that no matter what you eat, if you eat sugar, if you eat carbohydrates, no matter the amount of carbohydrates that you are eating, the normal range should be between 70 and 140 milligrams per deciliter. You should not exceed the 140, no matter how long have you been eating or how much you have eaten. Okay? And this is because in our body, we have a system that regulates the blood glucose. Our blood glucose is not steady in one level. It keeps on rising and then it goes back down. It's always in a dynamic state because someone who just ate 5 minutes ago or 1 hour ago is not like someone who ate 3 hours ago. Someone who did some physical activity is not like someone who is just sedentary. And even the same person, within the same person, if we check the blood sugar now, and if we check it after 1 hour, it's going to change because our body keeps on absorbing carbohydrates, sugar into your blood, and then the blood sugar goes into the cells or it gets stored, some of it gets stored, so it goes down, and then you eat again, and then it rises again in your blood, and then the body tries to lower it by either storing it or making use of it or getting rid of it. It's somehow regulated by a system inside our body. This system is important for us, okay? Because any defect within this system is going to cause diabetes. The levels are going to rise, and then we're going somehow to get diabetes. So which hormone that there is a specific hormone that is responsible for bringing our sugar down after we consume carbohydrates or sugar. What is the name of this hormone? And how it works, I'm going to explain insulin in a very simple way. Okay, as you see in this picture, okay, sorry, I'm shifting here because there is a problem with my voice, so I'm trying to be clear here. Okay. So, okay, how do insulin work? Insulin work by each cell in our body is having a gate, okay? And this gate allows the sugar and all the minerals and everything that the cell needs to come inside, okay? So whenever the cell needs anything from the bloodstream, it opens the gate and then this mineral comes inside or this substance comes inside and then closes the gate. Those gates, they open with certain keys, okay? And insulin is the key that opens the cell gate and lets the sugar in. So this is the job of insulin. It opens the gate of the cell, and then sugar is allowed to enter the cell and get what it needs for energy. Now, this picture illustrates how insulin works. As we have said, let's just consider that insulin is like a key. So it is produced in the pancreas, specifically the beta cells in the pancreas, they produce the insulin. As you can see here, the key. And those key go to the bloodstream. Once they reach the cells, they open the cell gates, and then the sugar goes inside, giving the cell the energy needed to grow or multiply. And as you can see here, the cell is nourished because it can do, in this case, it can do its job perfectly. It's full of life, and it can do the job perfectly. But on other cases, as we can see on the right side of the screen, the pancreas might be producing just little amounts of insulin or no insulin at all. Or sometimes when the insulin reaches the cell, as we can see on the cell on the right, okay, it cannot open the gate. There is a difficulty opening the gate. So all these factors, they can cause sugar to rise. And as we can see on the cell on the right, because it is not getting enough sugar, so it looks very weak, and for sure it cannot perform the functions that is needed on this cell to do. For example, if this cell is a muscle cell, then the muscles will not be able to give us the movements that we need, and we might feel tired or exhausted. And this is one of the symptoms of diabetes. So depending on either there is insufficient insulin or inefficient insulin, this is going to lead us to the types of insulin which we will know later on during this session. Okay, so tell me, what do you know about the symptoms of diabetes? And this time, I'm going to give you the question, and you can choose more than one answer about the symptoms that you know about diabetes. Okay, let's vote. We have a lot of options. We have headaches, we have frequent urination, we have weight gain, we have weight loss, lack of energy, wounds that heal fast, we have excessive thirst, we have hyperactivity, we have fever. So which of these symptoms you know that they are a sign that this person is having diabetes? Okay, I'm going to share with you the results. Okay. We have some people said headache, and most of the people chose frequent urination and excessive thirst, which is right. A frequent urination and excessive thirst are two signs or symptoms of developing diabetes. But unfortunately, weight gain is not a sign. Weight loss is a sign. And also the lack of energy is a sign. And they are all related to each other. They are all related to each other because a person with diabetes is having high sugar in his blood or her blood, and this sugar is not getting into the cells. So the cells are not getting, let's say, what it needs, the energy it needs. So that's why we feel very lazy. Okay, there is a lack of energy. And then because the blood is full of sugar or glucose, so our body tries to get rid of it by urinating more, okay? And so the more you urinate, then you will get dehydrated and then you feel thirsty. So all those symptoms are related to each other, and it's all due to the increased glucose in our blood. Okay, so this brings us to the types of diabetes. We have many types of diabetes, okay? But I'm talking here about the main types, the main categories of diabetes that everyone, each and every one of us should know, okay? So how many do you think, how many types of diabetes do we have? Or which are the types of diabetes that we have? Know, or most of us know that we only have two types of diabetes, which is either type 1 or type 2. Okay, but there is also another important category, which is the gestational diabetes. This is that diabetes that pregnant women develop during pregnancy. It's called gestational diabetes. Okay, we are going to explain them in details. We have 3 types of diabetes, okay? In type 1 and type 2 and the gestational diabetes. The difference between them, okay, is a big difference. In type 1 usually develops in children, okay, or at a young age. And usually it's due to an autoimmune disease, which means that our immune system somehow attacks the beta cells in our pancreas and destroys it. So our body cannot produce insulin. So there is no insulin at all. Our body is not producing insulin because the cells that produce the insulin are destroyed by the immune system. This is type 1. Usually it's discovered into young ages, sometimes children less than 5 years. Some children are born with type 1 diabetes. And then we get to type 2. Type 2, which usually develops in adults, okay? And some people, usually people are normal and healthy, and then they start developing type 2 in older age. And then the third type is the gestational diabetes. Usually this gestational diabetes is temporary. It is only during the pregnancy phase and after the mom or the mother gives birth, she gets back to normal. Sometimes she may develop into type 2 after giving birth. And we are going to speak about the gestational diabetes in a separate session in one of our upcoming sessions, because it's a big topic and it needs a separate and detailed session about it. Okay, as I said to you, in type 1, in our bloodstream, there is no insulin. So there is a need to deliver insulin from outside. That is why type 1 are called insulin dependent, because they need the insulin from outside. That is why they take injections of insulin straight ahead from day 1, diagnosed with type 1 diabetes. So they start taking insulin injections. While in type 2, usually our insulin either starts to get less or there is somehow it's inefficient. It cannot do the job fully. Sometimes the insulin cannot open the gate, as I told you earlier. So this develops gradually with time. And type 2 is the majority of people living with diabetes are with type 2. 90% of people with diabetes are type 2. So we need to focus more on type 2 because type 2 usually develops gradually, develops with old age, and not only with old age. I want to tell you something interesting, because till the end of the last century, okay, we used to know that type 1 diabetes only comes to children or small age groups, and type 2 develops in older age groups. But nowadays, we see even younger ages are developing type 2 diabetes. Younger ages are developing type 2 diabetes, and this is due to some environmental factors. Sometimes something is happening in our lifestyle. Our lifestyle is changing, so younger ages are starting to develop type 2 diabetes. So we need to focus more on type 2 diabetes and see what we can do about it. Diabetes can lead to serious complications. I'm going to show you, I'm going to do a small experiment, okay? So here, if you can see my video, okay? Here I have a tube. And this tube, let's assume that this tube is a blood vessel. It's a vein or it's an artery, okay? And then the blood is inside. And those are the red blood cells. Here you can see it down. Okay, those are the red blood cells. And of course, other components of the blood are inside too. Okay. Here is the same idea. Okay, it's also a blood vessel, but there is a difference between the two. So what is the difference? This blood here is a normal range blood. The blood sugar or blood glucose in this vein or in this artery is normal. While in this one, it has a high blood glucose. I'm going to turn those two tubes upside down and let's see the difference between the two. What happens? Okay, 1, 2, 3. Here we go. So can you see? Can you see the difference here? Look. I'm not sure if you can see it, but there is a difference in the speed. Okay. This is exactly what happens when we have a high blood glucose. With high blood glucose, the components of our blood are moving slowly. And we're not talking about only red blood cells. It's red blood cells, white blood cells, platelets, antibodies, nutrients, minerals, everything inside our body is moving quite slowly. And this makes it difficult to reach the different parts of our body. And this is why people with high blood glucose, they develop diabetes complications. And because the blood is the vessel that connects all our body, all our organs together, so most, or let's say all our organs will get affected if we have high blood glucose. So if we see the complications, which organs get affected? The blood vessels, the nerves, the brain. People might develop stroke, the vision, and this is one of the early signs that people recognize because a person starts to see some alterations in the vision. Okay, we have the heart might get affected, the kidneys, you might develop renal failure in late stages, and then the feet. And we have seen so many people that we know who have high blood glucose, they get their legs amputated. So those are serious complications. So what causes diabetes? What causes diabetes? Okay. Diabetes is caused by many, many factors, but we can divide them into two main categories, which are the genetic factors and non-genetic factors. Okay? Yeah, some part of the diabetes is inherited, and some is due to other factors. The genetic factors, okay, if you have someone in the family who's diagnosed with diabetes, okay, for example, if a person is diagnosed with diabetes and then his children, they have a higher risk of developing diabetes than other children whose parents are not diagnosed with diabetes. If the father only is diagnosed with diabetes, increases the risk. If the mother and the father are diagnosed with diabetes, this even increased the risk more and more. Okay, what about the gestational diabetes? Gestational diabetes, as I said before, it's temporary usually, okay, and usually the woman is, the mother is getting gestational diabetes, but after delivery, she's okay, but sometimes she might develop, okay? She's at higher risk to develop type 2 diabetes later on in her life. Not just that, even the baby who was born from a mother who had gestational diabetes is at risk of developing type 2 diabetes later on in his life. So those are the genetic factors. Let's see the other non-genetic factors, which we can call it environmental factors. Okay, we can call the environmental factors. On this image, you can see some non-genetic factors. Would you write to me on the chat box which factors that you see in here that might cause or might make you at higher risk of developing type 2 diabetes? I'm waiting for your responses on the chat section. High weight, that is right, absolutely right. High weight is one of the risk factors that might lead to developing diabetes, especially the fat accumulating around our waist. Okay, smoking, yes. People who smoke, they are 40% at higher risk of developing type 2 diabetes than non-smokers. So smoking is also a risk factor for developing type 2 diabetes. Unhealthy diet, yes, as you can see, this person is eating foods that are rich in carbohydrates and high calorie also. The fizzy drinks and the pizza. Yes, the lifestyle, yeah, lifestyle, that is right. The lifestyle, this all the what we have. Yes, exactly, excellent. And an inactive lifestyle, as we can see, this person is lying down, okay, and might be playing games or just navigating his laptop. He might spend hours in this sedentary time. And sedentary time is the time that you spend not sleeping, but not doing any physical activity. And the more sedentary time that you spend, then the more risk of developing type 2 diabetes. And as we can see here, this person is in sedentary state, and I think it's going to take long in that. Okay, a very important term that we need to know about diabetes is called the insulin resistance. Insulin resistance. Insulin resistance, this is the first stage in developing diabetes. This is when our insulin starts to reach the cell and there is some resistance in opening the gate of the cell. In this state, people usually start to recognize that their blood sugar is getting slightly above the normal range, slightly beyond the 140. Some people might get 150, 160, 170. This means that your body is starting to develop insulin resistance. And this brings the person from a normal range into something that we call a prediabetes state. This is a transient state. Okay, a person from a normal state goes into the prediabetes state, and this prediabetes state can either go to developing diabetes later on or to getting back to normal, and this depends on the commitment of the person. Depends if this person takes the organized and controlled and healthy lifestyle, is adding physical activity to his day, then there's a high chance that this person will go back into the normal stage. But if this person neglects this transient state and gained more weight, still maintaining his old lifestyle, no physical activity, then most probably this person is going to get into the confirmed diabetes state. Okay. So this brings us to the important question of this session. Is diabetes preventable? From what we have seen, from what you have seen with the previous image and the factors that can lead to diabetes, do you think that diabetes could be prevented? Can we prevent ourselves from developing diabetes? Yes or no? Okay. Okay. All people agree that yes, diabetes is preventable. Okay, just to make it clearer now, I just want to let you know that if it's type 1, okay, that is caused by genetic risk factors and a problem with the immune system, unfortunately, we cannot prevent that from happening. But if it's type 2, that develops throughout our life as we get older, then yes, type 2 is preventable. And we can easily do some measures to prevent ourselves from developing diabetes. Exercise is one of them. Exercise is very important. It's very good, and it has many benefits. And we have also a separate, our next session is going to be about exercise, the benefit of exercise in preventing and managing, controlling diabetes. Okay, let's eat healthy food and let's avoid any high caloric foods. Let's avoid eating fast food. Let's have more healthy homemade food, and let's make smart choices. Why not? Okay, and let's not smoke. Let's quit smoking, or let's try to stop smoking as much as we can, because this is very important in reducing the risk of developing type 2 diabetes. And just I have a small something to share with you about the healthy food and the healthy diet and the healthy lifestyle in general. Okay, there is a very nice book called the Qatar Dietary Guidelines, which was published by the Supreme Council of Health and by contribution of many organizations inside Qatar. Qatar Diabetes Association also is one of the organizations that participated in developing this book. It's a very nice book. It's about eating a variety of healthy choices. It shows you the 6 food groups and how to maintain a healthy weight. And it gives you some tips about physical activity, even about the amounts of each ingredient that you need per day, your daily need of, for example, of salts, sugar, and carbohydrates, everything, and how to adopt a safe and clean food, and how to eat healthy food and make to your family healthy food, and how to take care of your family. I am going to share with you the link on the chat screen. Okay, this is available in English language and also in Arabic language. And I'm quite sure that you will enjoy this book. Okay, do you get the link? And that's it for today. Yes, we can prevent ourselves from developing diabetes. And those are our accounts over social media. This is our helpline. If you need any help or any advice, or you want to ask anything, if you need education about diabetes, this is our line. You can call us. Our